Hello everyone, welcome to this audio podcast in this intermission series, or this intermission around the Labonix intermission. This is the Shientist, and this is another Storm Robotics production. So I'm going to provide an overview around this somewhat poignant sort of subject entity, looking at tackling health inequalities for all, and providing an overview around it. So in context of this work around tackling health inequalities for all, I thought I'd provide an excerpt in context of a particular aspect of healthcare. So in context of this excerpt, I'm gonna just highlight. I'm gonna highlight the works in context of a bit of an introduction, some aspects of aims, and some aspects of the methodology around this works, and some conclusional aspects, and then a bit of a summary around this. So the introduction around this is that in the United Kingdom, in England or the United Kingdom, unfortunately, one of the main issues surrounding healthcare is that patients with chronic illnesses, for example, those who might suffer from chronic kidney disease or CKD, are restricted to National Health Service, NHS healthcare services, and approaching healthcare provider or providers. Now, further complications can arise, especially for those who have healthcare challenges, and where misinformation can lead to fragility and health inequalities. Patient and public involvement, or PPI, can help bridge issues surrounding health inequalities. Now, the aims around this works was number one, to identify whether patients whether patients with chronic kidney disease would like to approach health professionals and patients through online consultations and educational support, thus prompting collaborative efforts. And number two, to understand if and whether CKD patients would welcome a more integrative support from healthcare professionals through social media or social media platforms, wherein patients and professionals can bridge gaps across health inequalities. Now, the methodology around this work was that in support of World Kidney Day 2022, the article of the works, the full works, looks to highlight how health inequality might be how health inequality can be bridged through online spaces and integrative practices between patients and health professionals. In line with a sort of a discussion in this works, patients are the intermediaries between primary and secondary healthcare services or sectors, and chronic kidney disease patients now generally have more opportunity to share lived experiences owing to the nature and the implementation of social media platforms. For example, the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS for kids. And the conclusion around this works is that in addition to sharing experiences, this prompts patients to be more than mere recipients of healthcare. CKD patients, for example, now have opportunity to become more empowered, so that more informed decisions can be made. And the summary around this is that education intercessions are required generally to offset issues where there are inequalities, but also to ensure excellence in healthcare practices. In regards to specific terminologies around this work, those include healthcare, education, screening, and long-term conditions. So in context of acknowledgements, here to acknowledge an academic, where there was an academic collaboration. There was a collaboration in line with the the Arena Patient Support Group, the RPSG, and a collaborative effort with the Kidney Disease and Renal Support Group, or KDAS, for kids as well.